It's great to be able to meet everybody and get to know a little bit about you guys. Thank you for letting me have an opportunity to come and share about music therapy this morning. Let me tell you a little bit about myself. My name is Mark. You guys have figured that one out, but I have been serving as a music therapist for about 7 years, and I've always been on the south side of Atlanta. I have kind of gone from a few different places. I have worked in many different populations. The population I've worked with most has been with oncology. I served at the Cancer Treatment Center of America for about 5 years as a music therapist. I have also been with Back on Track for about a year now, working with children of a couple of different ages. I also do work as a music therapist in geriatrics right now, and I go and visit hospitals. I know that a lot of people are kind of asking, what are you doing during the pandemic? And I have actually been going into Piedmont Noonan and Piedmont Fayette and doing music therapy for nursing staff and medical staff a couple times a week at each hospital for night shift and morning shift. And it has been really fulfilling for me to be able to do that. It has just been a really great experience. So that's a little bit about myself. And I'll go ahead and jump into this presentation, and then as we go towards the end, you're welcome to ask as many questions as you like, and I'll be happy to answer them. Let me start with a little bit of background about music therapy, since I don't know if everybody here has ever met or worked with a music therapy. Some of you music therapists, but some of you probably have. But let me just go ahead and tell you about music therapy. It has been documented throughout all history that music has been used and beneficial for people with different kinds of disabilities. My favorite example is being a Christian is talking about David and using music to be able to soothe King Saul and his melancholy. So we have our Bible reference to being a music therapist. So local musicians are kind of like where all music therapy started in our modern times. So back around World War I and World War II, musicians from the local areas would go into veterans hospitals and play music for the veterans who were dealing with like PTSD and trauma. And they would go in and do this, and it became so popular and so useful that the hospital started paying them to come on staff. And so those are like our first paid music therapists. But at that point, there was no credentialing that had to be done for music therapists. So as more musicians came in and started doing this, they realized they needed to have some kind of educational process for people who were coming in and doing music for patients and not just performing. So I believe it is, I have it on here. Yes, the first music therapy college program was started in 1944 at Michigan State University. The CBMT was formed in 1983, which is the board that does our certification. It became the accredited testing standard for music therapists in 1986 and has been our standard ever since. And as of this moment, and I think January 1st became 1990. No, that is, I got that information in there wrong. It is not 1994 when music therapy became required to have a license in the state of Georgia. It was 2014. Don't know why that date came in wrong, but it was actually 2014. Music therapy became you had to have a license to be able to perform music therapy in the state of Georgia. It is now required in 13 different states across the United States that you have to have a license to be able to become a music therapist and practice in the state. We're working with advocacy groups across the country every year to be able to have that become the standard across the nation. So that kind of gives you a little bit of a background about music therapy, but what is music therapy really? And so music therapy is a clinical and evidence-based approach in utilizing musical interventions to help the needs of the client. Of course, I'm speaking to a bunch of like therapists, so I'm assuming you all understand the idea that when you have an evidence-based approach, you want to be able to track what you're doing, document what you're doing, and that your goals and your objectives are reasonable, that they're timely, they follow all the SMART rules, so that you're able to actually have a good therapeutic intervention. I'm going to be sipping on my coffee throughout. I hope that's okay. So you would talk about the assessment needs that may come from the intake of a client. That can be assessed by a professional that is qualified to be able to do that, or a music therapist can use an assessment form to be able to assess what the needs are, depending on what you're trying to accomplish as a music therapist. A lot of times, doctors can be the person that can give that assessment and say, this is what we need to have done. But as a psychologist, a psychotherapist, we have different people who can do that. A licensed counselor could give that assessment and say, this is the needs of the client. And we think music therapy would be the best way to be able to handle this. But sometimes parents will come to music therapists on their own, and it'll be up to the music therapist to be able to give it a good assessment and create a treatment plan that's workable for the client. So it differs from different settings. Like I said, I work in a bunch of different settings right now, so music therapy is a little bit fluid for me. Is there any proof that music therapy is a viable way to treat somebody? Of course, we have anecdotal evidence throughout the years that it's been useful all the way back to when it first started. But that is not viable enough to be able to say that this is a profession. So there's actually tons of research that's available through different journals, medical journals. The Music Therapy Association has 2 journals that they put out every year. And I think they happen actually every quarter, is the Journal of Music Therapy and Music Therapy Perspectives. Perspectives is more qualitative research, while Journal of Music Therapy is more quantitative research. But I've been able to present at conferences, both music therapy conferences and like mainstream medical conferences like the San Antonio Breast Cancer Symposium. And you have to be able to pull research from not just the music therapy field, but like, what are they doing all over the world? And you can see that when you go and look at the research, you could find music therapy being used in so many different settings, in so many different populations. And there's tons of research, and it keeps getting added to every year. So I put a list of the populations that I work with, but music therapists work with almost every population you can think of. But I have worked with normally functioning adults. I have worked with children, with disabilities, without disabilities. I have worked with the elderly. I have worked with developmentally disabled adults. I have worked in oncology. I didn't put this, but I've also worked in forensics health. And I know that there is even a specialization certification for NICU. I'm not certified in that. I don't work in that. But there are certifications for that, and you can get those at Florida State University. Is kind of they piloted that. But I'll tell you that not every music therapist is cut out to do every population. The music therapist has to pay attention to what they're doing and find the places that they're supposed to be working. You can't it's very ambitious to think you can work with just anybody, but not everybody's meant for you. You have to be able to check what your biases are and check what your strengths and weaknesses are. I'll tell you, I learned a lot by working at Forensics Health about who I was, and that was not a population that I could work with. I appreciated my time working with the DBHDD, but it was not for me. I have my particular nature didn't suit to working with people who tended to be like paranoid and violent. So moving on to the next slide. I wanted to go through, and for the rest of this presentation, I kind of want to just get off of like the background and talk about like the cogs. So I just grabbed, this was a like a case study that I did once that I've gotten rid of all of the information on there that would be identifying to this client. And this is not a client that I currently work with. This is a client I worked with like several years ago. But I just wanted to go through and show you what it looks like, what a music therapy assessment would go through. And we would just go through all the different domains in our assessment and say, you know, what we want to take a look at what they're going through and what are their needs and where can music therapy fit. So you can, I'm not going to read off all of this, but I'm going to leave it up here just for another minute. So if you want to see, but you can see that we want to go through what has he been diagnosed with, what is his background, and then what are his different strengths and weaknesses in these different domains: motor skills, music, emotional, social. And I'll go through and I'll look at the strengths and the needs and just kind of point out that Lou, you saw that he has autism, and he's intelligent, he works, he responds to music, he can make independent decisions. Lou he grasps that he has these different emotions. He can kind of express them, but he can't express them well. He needs to be able to participate in group singing. He needs to improve his sentenced responses more than yes or no answers. He needs to be able to hold appropriate eye contact, improve fine motor skills, and needs to improve rhythm skills. These were all things that were brought to me by the organization that I was working with at the time. And so I said, well, what was his priority need? Something that would help him the most. And I thought being able to use sentences to communicate was the priority need. So our goal was to increase the communication skills. And the objective is that Lou would use simple phrases to communicate how he feels and what he wants. So I'm going to go ahead and go into an activity. I hope you all are ready to do an activity with the music therapist today. So I assessed what it was that he needed, what was his priorities, and how can I help him as a music therapist? What intervention could I use to encourage him to use phrases, to be able to use simple sentences? This is a little activity sheet that I put together. It's call and response. Call and response is a very common way to do music. It's done in a lot of kids songs, but you have probably done them in we do them in all sorts of different songs. We can I'm trying to think of some more like adult songs, something that we do where we have like a call and response, but we'll have something like Mustang Sally is one that a lot of the older generation likes, and it'll say, all you want to do is ride, Sally, ride. You know, like all you want to do is ride around Sally. And then everybody says, ride, Sally, ride. That's a great one to do. But I've picked out the song, The Green Grass Grows All Around. It's a great kid song. And so I put down a list of how to actually do the activity here. You can take the procedure, and all you really need is an instrument. And if you don't feel comfortable playing an instrument, which is what I'm assuming some of you guys may not be comfortable doing in music, these like The Green Grass Grows is a song that you can get on Spotify or on iTunes or YouTube, whatever form that you want to be able to get. Of course, I am a music therapist and I have the skills to be able to play a guitar, so I'm going to go ahead and see if I can. This particular kind of song is called a ladder song, so you add to it as you go. And this is called The Green Grass Grows All Around, and you would say, there was a tree, and then you would have there was a tree out in the wood, the prettiest tree, prettiest that you ever did see. Now the tree in the hole, and the hole in the ground. Then you would go out in the, there was a tree out in the wood, the prettiest tree that you ever did see. And then you say on and oh, I'm sorry. And the green grass grows all around, and the green grass grows all around. I forgot the chorus. And on that tree, there was a limb, the prettiest limb that you ever did see. Oh, the limb on the tree, and the tree in the hole, and the hole in the ground, and the green grass grows all around, and the green grass grows all around. We can go through the whole song if you wanted to, but I'm going to spare you having to listen to the whole children's song this morning. Now you'd say, maybe this is not working. Maybe we're not getting the response that we want. And you can prompt, you can try to say, sing with me. Like I was doing just now, I was singing the echo along with the main part. But maybe you want to go a little bit further and you want to build this in, or you want to get it to be generalized. So you could change this to maybe you're trying to work on your morning activities, being able to go get up, brush your teeth, put on your clothes, and go and make breakfast. So you can say, when I wake up this morning, I woke up this morning. I woke up this morning and I got out of bed and I went to go and brush my teeth, and I went to brush my teeth. And then you can continue and add on to that, or you could have the client add to it. What is in the tree? It doesn't have to be a limb. It could be a bird. What's the bird on his nest? What's the squirrel on? What's the moss? These are just different things, but you can see that there's lots of ways to be able to take an intervention and make it vary to wherever your client level is. And that's using music to be able to do an intervention that's a non-musical goal. You're trying to be able to help them speak and use phrases, not to be able to sing the green grass grows all around, but you're pairing it in with music, and that's a great reinforcer.
I have to say, I used to be an elementary music teacher.
Yes.
And so this is just like putting me in my other life.
Certainly.
Amy, you're not unmuted.
I have a question mark while you're getting that ready.
Do you see the activity development sheet? Is that pulled up?
Yes, you do.
Okay, great. Yeah, go ahead.
So I'm thinking a lot about, so I'm also a certified medical rehabilitation counselor. I work mostly with couples these days, but so I work a lot, but almost all of my couples have some sort of chronic illness or disability. And then the other thing, so I'm thinking about a couple different things, but one is anxiety, medical anxiety in particular. What this might look like for an adult with medical anxiety, maybe about an upcoming procedure or about their partner's upcoming procedure or their child's procedure.
I'm typing this in because this is perfect. You're breeding us right into the next activity. Awesome. Okay, so the adult, we're looking at an activity development sheet, and we're going to work together to take a couple of different things that you guys might be working with, and how can you turn that into a musical experience that might help your client. And this is just a development sheet that you could take and use. You probably have something like this you've used before, but I just thought we might work through this together. So we have an adult with anxiety for an upcoming medical procedure, right? This is great. This is perfect. All right. So what's the needs of this client? What are we trying to do?
Help them cope with the anxiety.
All right. So we have this need. I have some ideas about musical experiences that might be able to help with this, but I'd love to hear some people maybe think about some ideas. How could music be helpful for anxiety and being able to help to cope with anxiety?
Like calming music. They could
like
listen
use it
to.
in a meditative kind of way. And maybe even a mantra in the song that's about positive messages.
And I think the
how I feel
opposite.
it.
This is Allie. Sorry.
Mm-hmm.
I think the opposite. I sometimes have used like dance kind of heavy music for people, like whatever they pick, to basically get up and move and like get it out of their body in that way.
Mm-hmm.
Great. That's wonderful. This is all very useful. So, and it might depend on the client, right? So a client may not be able to do dance heavy, but you may have a client that has pent up like energy, anxiety, and dance might be the better option, right? So how would we kind of like let's kind of split these up into two, because they're kind of opposites of each other, and just kind of write down like how could we implement this in a way that's going to help the client, and how might we be able to track it, right? Because we got to be able to track it too. And like what would, as a music therapist or as a therapist, you want to be able to say, you know, how did this help this person? With an anxiety, there's the GAD-7. You could use the general anxiety disorder tool to be able to say, you know, fill this out and then next week fill it out again, and depending on how, if you're doing your intervention, did it help? And a lot of times music therapy, especially when it comes to adults, it's not doing, you can do the intervention there in session, but you might send them home with the intervention to be able to work on it on their own. This happened to me a lot when I was working in cancer. I would work with patients who are about to have surgery, and they would need to deal with anxiety because they were worried about their surgery, or if they were going to get their test results back, they would be in that waiting period about, you know, I'm a little nervous. Am I going to come back with good test results? And so how can we do that? The calming music, you don't have to be a musician to be able to have calming music, right?
Mm-hmm.
You can have calming music that is found on your iPhone, on your whatever smart device you have. You can pull up meditative music or a mantra. There are mantras out there that you can find on YouTube that you can do. That would be another great activity that you could do in your session, would be to create a mantra. So what would be a good, I've done this before in group sessions for support groups, where we would write down just a couple of phrases that we could say and then repeat to the rhythm. So let's just come up with a couple of positive phrases that we can repeat to music. Anybody? This is the participation, a positive phrase.
I am well.
Yeah.
I am well.
Mm-hmm.
I'm at peace.
I am at peace.
I'm healing.
I am healing. That's great. Let's say those are three great phrases that we can use. I don't know how to share recorded music through Zoom yet. I've been trying to figure it out, but I think there's something to do with licensure that prevents Zoom from being able to share music. Maybe I just haven't been able to figure it out. So let's just say we've got a nice calm. Can you hear the guitar?
Yes.
And we're gonna just come up with a nice rhythm. We're gonna say, I am well. I am well. I am well. And we're just gonna keep repeating, I am well. And we can, once we say that, we're gonna say, I am well 4 times, I'm at peace 4 times, and I am healing 4 times. I am well. I am well. I am well. I am well. I'm at peace. I'm at peace. I'm at peace. I'm at peace. I am healing. I am healing. I am healing. I am healing. And some of your more musically inclined clients may take it and run with it. It may become a song for them. It may become something that they want to put down and record in the future. It might just be something that they do. What I would prescribe that patient did is that it needs to be done more than just in session. That'd be something that you need to take with you and do over the course, probably a couple of times a day at least, and try to do this. And it doesn't have to be the mantra the entire time, but putting on that calming music and maybe going through the mantra at least once during that for 30 minutes twice a day could be a great way to be able to just get that relaxation in. One thing that I've done with clients that were about to have their surgery or about to have some kind of procedure is to try to do this at least a couple weeks out ahead of time. Because what you do is not only do you get that feeling, but you get the practice in. Because it's not easy to meditate right away. If you've never done it, meditating can be challenging. So this is something that you could work on over those couple of weeks, is helping someone to learn how to meditate, to be able to get into that relaxed state. And then see if you can work with whatever place that you're working at and see if they can take their music with them up into the point of the procedure. They probably can't take it with them into the procedure to be able to help unless they are conscious and the doctors say it's okay. But I have gone and done music therapy for people all the way up into where they were about to go into their operating room to be able to help them deal with anxiety. People who have high anxiety and high blood pressure tend to have trouble being able to get sedated for their procedures. So music therapy can be really helpful in that, to be able to help the anesthesiologists get them where they need to be without having to use a ton of medication.
You know, I knew of someone who went to the dentist and was having a procedure done, and it threw her into a huge meltdown, anxiety, depression, all that. And at the dentist chair, you could have that on your headset.
Yeah,
you know?
Absolutely. And doing this over time, I'll tell you, if you've ever done music relaxation, the calming part of it, over time, you'll find that you'll have automatic response to it as well. You kind of behaviorally train yourself to be able to have that relaxation. I want to go and look at the dance, heavy music to move. I don't know why I put it in there. Dancing to reduce stress. What kind of songs are we thinking for dancing? How are we getting people moving?
That song, I am happy, da, 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 da. That happy song.
Mm-hmm.
Oh, is that the Pharrell song, like because I'm happy, da, 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 da. Okay, yeah, that's a great song. That gets people moving all the time.
Mm-hmm.
That's a very popular one. And let's say, I mean, it's going to be like client choice, right? This is something that the clients are going to want to be able to pick out. And so I feel like that's like almost something you could measure acute, like before and after, like before dancing and after. So that might be something that you could do as a subjective assessment, like before you start the dancing. Like, how are you feeling? What is your mood? What is going on to help you be able to do this? Where are you right now? And go through that assessment and let them fill it out, and then you could say, all right, so we're going to move on to do a dance. How could we facilitate to get them dancing? Because not everybody's going to be ready to jump up and dance, but maybe that's what they need.
Mm-hmm.
Well, that's what do you guys think?
We'll do it with them. Is one
Sure.
way.
Yeah.
I mean, some people might feel embarrassed or self-conscious,
Yeah.
and that may help them not feel inhibited.
You can start with just moving your feet. Like
Yeah.
you can stay seated and just move your feet.
Yeah.
I've also even some of my clients have asked, I've turned around and just let them go crazy.
Oh yeah, that's great. That's great.
It's been a long time, probably when I was still interning, but at one point I did have where we both just closed our eyes and moved.
Yeah,
while seated.
It would be interesting to do, if you're doing it as a group, to do one of those dance parties, but everybody picks out their own music and listens to headsets, where it's like like the silent prom kind of thing, where the people are just, everybody's listening in their ears, but they're not actually like playing it out loud in speakers. If you wanted to do that and have everybody make their own choices, it would even be really interesting to see, like, at the end, what is it that you chose to dance to? What song were you dancing to? Because people might choose different songs and they're dancing. Some might be dancing slower. Some might be dancing faster. That would be a really interesting kind of exercise to see how that would all go. I like the idea of having those prescribed, like having prescribed steps too. You could say, what is that song where it's like they're like, step it back now, y'all. One time this time. It's like, now clap.
Slide.
That would be, yeah. The Cupid shuffle.
Yes.
You could facilitate someone going and dancing if it has prescribed steps, and that would be able to get people to just kind of, like, maybe that's what you need to get them to be facilitated. I really liked what Ruby said about just turning around and saying, like, if you don't want to, if they feel nervous about dancing in front of someone, just putting on the music and let them just like do whatever you want, and I'm not going to watch, and give them a chance to just kind of be crazy. And then if you have the stay seated and start with the feet, that would also be a great variation to be able to help people who are they can't get up, come up with some dance moves that can be performed while seated.
Yeah.
Modify the activity to the person, so people can still dance even if they can't get up out of their chairs. And that can be a lot of fun. I worked with a lot of disabled adults when I was back in doing my master's program, and those guys were just the best. They had so much fun. They would always, music was huge for them. All right, I think we've done that one. Let's go and try at least one more before we get closed up. I have one more activity that I want to do that I kind of came up with for today, and but I want to go through one more if anybody feels comfortable sharing something that they want to work through.
I think it'd be a good one to like maybe like because of the whole COVID and being quarantined to do one where we're talking about like you know, wanting to get out, can't get out, or having anxiety around being stuck in the house.
And do we have a population that we're looking at, or are we looking at different ages and everything?
Let's do a teenager.
Teenager.
I was gonna say, I've been talking to some of my teen clients about this.
Yeah. A lot of the teens are struggling, missing prom, missing driving, missing going to work.
So what are the needs? What do we need here? This is probably coping with anxiety, right? But what are some other needs that we could address?
It could be depression too.
Yeah.
Yeah.
Boredom.
Boredom. Yeah. Okay. So we have a few different needs that we can
It's
address.
also somewhat of a hopeless state. Like, no one's telling us when this is going to end. You know,
Mm.
losing hope.
The social isolation, just getting to them.
Great. A lot of different things we can look at here. What are some musical experiences we think we can come up with that could help deal with this? I'll tell you one that I love doing is lyric analysis. You could take like a favorite song and then you can pull up the lyrics. You could do this. This is to be a very helpful. This could be a telehealth intervention that you could do. Is let's say you have your favorite song. Let me see if I can pull up. 1 second. I have a song that I actually heard on Spotify yesterday called 6 Feet Apart by Alec Benjamin. All right. So here's the lyrics. They say distance is relative, and relative to relatives I say I'm relatively close to breaking down because right now I feel so alone. I've been missing the elements and wishing the elephant in the room would leave and kindly close the door. I can't ignore him like before, not anymore. And oh, I miss you most at 6 feet apart when you're right outside my window, but can't ride inside my car. And it hurts to know just how lovely you are and be too far away to hold, but close enough to break my heart. I miss your smile, feels like miles 6 feet apart. So this is a song that was written for this particular situation that we're in, right? This is obvious,
Great.
obvious, right?
You really do that with a teen and say, you know, check
Oh.
these lyrics out. Do you relate to this?
And you would listen to it first, and then you could talk about two different elements. Most songs are broken down into two different elements. There's the lyrics, and then there's the music, right? There's the what instrumentation is going on. What
Why
is
you
the
pick that instrument for
Mhm.
that? Yeah.
And what's the sound of that instrument? Does it sound happy? Does it sound sad? Music is a great way to express emotion. And even without the lyrics, you'd probably be able to listen to that song and feel the melancholy in the song.
So that song is called 6 Feet Apart, and who wrote
Yes,
it?
Alec Benjamin.
But that song, even though it doesn't have like end with good news that this is over and we're back or whatever, just to be able to relate to it
Hmm.
and talk about it would
Yeah.
help a client, I think.
Yeah, I think that's kind of where they're at. And that's, I think, if you were to ask yourself where you were at about all of this, you may be able to identify with it as well. I think that's why some of us probably, when we listen to that song, tear up a little bit, because it's like, yeah, when I first heard it too, it was emotionally driving for me, because I was like, yeah, I totally get where this kid's coming from. And even though, like, yeah, I mean, I've got my family here, but I have so many people that I'd love to be able to go see too. So it's easily identifiable. This is a great way to be able to talk about those lyrics and say, you know, what about this do you identify most with this 6 Feet Apart song. We could pull up the lyrics and just go through each verse and even talk about like the register of where he was singing, because it was way up there, right? It was like all falsetto the whole time. And there was, and it almost sounded like there was a quiver in his voice. Like even while he was singing, he was sad. So that's all kind of stuff you can hit on when doing lyric analysis about that. So that's one that I would share as a great way to be able to talk about coping with depression and boredom, is just to maybe not come up with an answer, but at least to be able to put words to it, which is very difficult.
Maybe have them write a song.
Okay. Yeah. Songwriting is a great way to be able to cope with something like depression and be able to work through this kind of stuff. We could talk about like, what does it mean to be socially distant? Like that could be a whole verse about like having to be 6 feet apart, right? Or what does it mean to not be able to go to school for the rest of your school year? How do you feel about missing prom, or your senior trip?
Graduation.
That's a big step. It really hurts to not be able to do that. So we could do a songwriting activity, and I would suggest, if you don't have the musical skills to write a brand new song, is to do something called piggyback. And you can take what's already there and write your own music over it. One piggyback that I like to do, and we're getting close to that time. We've got about 12 minutes left before people need to leave. So I'm gonna go ahead and maybe we can close up with this activity, and we can go into some more questions. But I hope that this has been helpful for you guys in thinking about music and thinking about it in a methodical way on how to take a need and turn it into a music activity. All right. So this is a song I think you all know. If you can mute if you want, or you can sing along. I don't care. You're not going to bother me. This is called "Don't Worry, Be Happy." Mm-hmm. Right. I've been singing this a lot to the nursing staff at the hospitals. And this is a great piggyback song. It's easy to write extra lyrics in here. And I don't know if it's going to work for teens or not. They might get into it, especially if you have some instruments for them to play. But let's do it. It works with some of the kids that I work with. Here's a little song I wrote. You might want to sing it note for note. Don't worry. Be happy. In this life, you'll have some trouble. If you worry, you'll make it double. So don't worry. Be happy. Don't worry, be happy. Ooh, don't worry. Ooh, be happy. Ooh. And at this point, I'd like to say, like, let's add a verse. What are you worried about with this virus? What worries you the most?
Trying to keep working and homeschool my children and not lose my mind.
I just unmuted myself. This is Allie. I was going to say being stuck at home with these kids for 3 more months.
All right, let's see how that sounds, right? Say, stuck at home working with the kids. I can't do it for 3 more months. Don't worry. Be happy. And it's just that simple, right? It doesn't have to rhyme. Music often doesn't rhyme. You just don't think about it, but you could. It doesn't have to rhyme. Just say what is it that worries you. You could do a follow-up verse. This is just how can we, what can we do to make it better? What can make us happy during this time? I'm going to find 20 minutes to myself. I'm going to tell the kids to leave me alone. Don't worry, be happy, right? You have wrote your extra verse to don't worry, be happy. This could be done with kids. It can be done with teenagers. It can be done with adults stuck at home working from their computers. It can be a fun activity. Everybody's smiling. I hear lots of laughter. It's a great way because you're to just kind of get it out there and look at it from a positive note.
I'd love to hear more about your time in the hospital. Wow. Can you tell us anything else?
Yeah, we'll go ahead and move on to the Q&A if that.
I want to share something that my family has done during this quarantine. My extended family, my daughter had this idea of doing like a music game. So a music singing game for the family. So one person sings, and whatever word they end on, the next person has to start a new song with that word.
Mm-hmm.
And we've done the videos on WhatsApp, and she's going to put it all together at the end. It's been really fun to connect the whole family during this time.
That's a great idea.
That's cute.
You could do that. You could do that whenever we get back and you're doing a social group. You could do that with your support group to be able to pass lyrics around. Or you could do cooperative storytelling where you could start a story and then pass it on to the next person and they have to finish that story. Those are great ways to do stuff.
Mark, what's the best way for us to refer? Do we just give them the Back on Track number? Or?
Yeah, that's fine.
Okay.
That is fine. Just go ahead and go to the Back on Track and I do my individual work through there.
Awesome. Well, Mark, I really appreciate you giving us your time this morning and your expertise. I learned a lot, and definitely hoping to send some people your way, and
Great.
think that you could be really, really helpful to a lot of the of our community. And so I think it's a great resource for us to know about.